So my presentation focused on decision making for children with cancer. And we really looked at the various aspects which we needed to consider when we are making decisions, trying to choose wisely what course of treatment to take for the children. And we really emphasized on the fact that children don't make a decision on their own. So you have to talk through the parents. And when children are involved, not only the parent is able to make the decision, sometimes themselves, they are not sure who to involve to really make the final decision. Is it the grandparents? Is it pastors, aunties, uncles? So all this depends on the background of the culture. So I really like this event. So when we got this information, we were actually on a tumor board and we were discussing about a patient who had an advanced cancer, and there was this option which was very expensive that was thrown to us by interventional radiology, that they could try do it, which was quite expensive, to just maybe it will make his life better. And so when we were discussing about this, should we really try this? Should we really tell the parents about this? Should we keep the patient longer? And then I shared this email about this one, and we said, you see, we must attend this because the topics are going to be discussed are relevant. So I really think quite a big number of people from my team, pediatric oncology, have attended this symposium, and we are all interested to look at this. And we were catched up by that decision, the treatment, the investigations necessary for the patient. And we are constantly faced with this challenge to decide either for the particular patient, should we really go for this treatment? When a patient is palliative, should we involve chemotherapy or should we just manage pain, especially when we consider the resources available, but as well what it costs the parents to be away from home and stay at the hospital for extra 2 months. Yeah, I think what I needed to add is that decision making and choosing wisely is very dynamic. So the same decision I would made last week may be different today because quite some things have changed. The nature of the patient or the available treatment around. Like I said, for acute myeloid leukemia, we are not treating a year ago, but now we are able to embark on treating. And we think now when we choose to treat a child with acute myeloid leukemia, we are choosing wisely. But a year ago, we thought this was not a wise decision. So this is very dynamic, and as doctors, we needed to abreast ourselves with knowledge and current evidence, but all the time put in context our reality, but as well prioritize the patients and their families.